You probably think you're just tired. But what if your body is actually fighting for air every single night? Do you snore like a chainsaw, gasp for air in your sleep, or wake up feeling like you never slept at all? This is obstructive sleep apnea, a widely overlooked crisis affecting your brain, heart, and future. OSA affects between 9 and 38% of adults globally. In older men, the number can reach 90%. In women, up to 78%. In the US, over 18 million people live with OSA, yet mostly remain undiagnosed. OSA often hides behind symptoms we dismiss: yawns, forgetfulness, poor focus. Like we learned from our lecture on April 8th, obstructive sleep apnea happens when the muscles in your throat relax too much during sleep. The airway narrows or collapses, cutting off airflow, even though the chest continues trying to breathe. This disruption can result from several structural or physiological causes: excess fat around the neck, a recessed lower jaw, enlarged tonsils, or reduced muscle tone due to aging or neurological conditions. Each time the airway collapses, oxygen level drop. The brain quickly responds by waking the body, not fully, just enough to take another breath. This jolts the heart, spikes blood pressure, and releases stress hormones into the bloodstream. This cycle can repeat dozens or even hundreds of times per night, and you may not remember any of it. The effects are far-reaching. Obstructive sleep apnea increases the risk of high blood pressure, stroke, heart failure, atrial fibrillation, and type 2 diabetes. It is also closely associated with depression, anxiety, chronic fatigue, and impaired cognitive function. Over time, untreated OSA can reduce life expectancy. The effects of sleep apnea extend beyond the body. They ripple through society. Like we learned from Lecture 8, sleep disorders like OSA can cause drowsy driving. Drivers with untreated OSA are more likely to cause traffic accidents. It impairs alertness, reaction time, and decision-making, similar to alcohol. It's not just the driver who's at risk, it's everyone else on the road. The economic burden is also heavy. Untreated OSA is linked to increased healthcare usage, including ER visits, hospital admissions, and medication costs. The total estimated cost of untreated sleep disorders in the US exceeds $130 billion annually, comparable to diabetes. And then there's the productivity loss. Sleep-deprived employees make more mistakes, take more sick days, and struggle to focus. Early intervention isn't just about health. It's about efficiency, safety, and economic sustainability. OSA is not a new discovery. In 1837, Charles Dickens described it in the Pickwick Papers. By the 1950s, physicians had it named Pickwickian syndrome. Research in the 60s and 70s used EEG and breathing bells to reveal the mechanics of disrupted sleep. In 1981, CPAP was introduced. It was the first non-invasive solution for keeping airways open during sleep. We now understand that OSA is a complex disorder involving anatomy, muscle tone, and neurological signals. Over the years, several treatment strategies for OSA have been developed. CPAP, continuous positive airway pressure, remains the most common and effective treatment. By keeping the airway open during sleep, it reduces apneas and restores oxygen flow. Other approaches include oral appliances to reposition the jaw, soft tissue surgeries, and implantable nerve stimulators. Many patients benefit from these options, but not everyone has access. Historically, OSA has faced barriers at nearly every stage: delayed diagnosis due to low symptom awareness, inconsistent screening protocols across hospitals and specialties, and insurance policies that only reimburse testing after major symptoms appear. Even patients who do receive a diagnosis may struggle with long wait times, device costs, or treatment adherence. Screening tools like StopBand have helped, especially in surgical and cardiology settings. Newer tools like SPOSA use electronic health records to identify high-risk patients before surgery, improving outcomes and lowering costs. But broader integration into routine care is still lacking. What would it take to actually fix this? We could start with the basics. Make home sleep tests as normal as blood pressure cuffs. Make them small, accurate, and easy to use at home. Then we could triage smarter. AI can sort patients based on risk, not paperwork. Urgent cases go to CPAP or surgery. Mild cases get tracked and supported, everyone enters the right path faster, we could also raise the stakes. Let's stop treating sleep like an afterthought. Make it a core health metric. The UN Sustainable Development Goal 3, Good Health and Well-being, can recognize sleep quality as a public health priority. This isn't a moonshot. In the first year, we can integrate screening tools like StopBand into every primary care visit. By the second, start paying for home tests, especially in underserved areas. And by year 3, build AI triage into hospitals and monitor what works. Of course, there are barriers. Most doctors don't screen for OSA, not because they don't care, but because no one taught them to. And many insurance systems still see sleep testing as optional, not essential. But we can change that. Add sleep apnea screening to medical school and hospital training. Create funding incentives that reward early diagnosis. Bundle sleep testing into care packages so it's easier to access. And the impact? More people would be diagnosed earlier. There might be fewer emergency admissions and fewer accidents. More people could finally sleep through the night and get their lives back during the day. Obstructive sleep apnea is measurable, treatable, and preventable. With smarter tools, better screening, and stronger health policies, millions can sleep and live better. So if someone you know snores loudly, seems constantly exhausted, or wakes up gasping, don't look away. Encourage them to talk to a doctor. It might change or save their life. This is Cecilia Xiu from the course Harvard General Education 1038 Sleep. Hope you enjoyed this video. Thanks for watching.